Safety and efficacy of the use of lumen-apposing metal stents in the management of postoperative fluid collections, a large international multicenter study. Introduction. Postoperative fluid collections, POFCs, are a recognized source of morbidity and mortality. POFCs were historically managed with surgical re-exploration and drainage. However, this approach is invasive and results in significant morbidity. Over the past decade, image-guided percutaneous drainage has been increasingly utilized and has proven to be a safe and effective treatment option, with success rates between 60% and 84%. However, depending on the location of the POFC, percutaneous drainage may not always be feasible. Several reports have described endoscopic ultrasound, EUS-guided, drainage techniques in the management of a variety of intra-abdominal POFCs using plastic and fully covered self-expanding metal stents, FCSEMSs, with technical and clinical success rates of 96% to 100% and 80% to 100% respectively. However, plastic stents and FCSEMSs are not designed for this indication and carry risks such as stent migration and bleeding. Recent literature has shown excellent safety and efficacy for EUS-guided drainage using lumen-apposing metal stents, LAMSs, for the management of symptomatic peripancreatic fluid collections resulting from pancreatitis. However, data on the outcomes of this approach in the management of POFCs remain scarce. The objective of this international, multicenter, retrospective study was to evaluate the clinical outcomes of EUS-guided transmural drainage of POFCs using LAMSs. Background. Multiple studies have examined the use of lumen-apposing metal stents, LAMSs, for the drainage of peripancreatic fluid collections. Data on the use of LAMSs for postoperative fluid collections, POFCs, are scarce. POFCs may lead to severe complications without appropriate treatment. The authors aim to study the outcomes, technical success, clinical success, rate and severity of adverse events, length of stay, recurrence, of the use of LAMSs for the drainage of POFCs. Methods. The international multi-center retrospective study involved 19 centers between January 2012 and October 2017. The primary outcome was clinical success. Secondary outcomes included technical success and rate and severity of adverse events using the ASGE lexicon. Results. A total of 62 patients were included during the study period. The most common etiology of the POFCs was distal pancreatectomy, 46.8%. The mean diameter was 84.5 millimeters, standard deviation 30.7 millimeters. The most common indication for drainage was infection, 48.4%, and transgastric drainage was the most common approach, 82.3%. Technical success was achieved in 60 of 62 patients, 96.8%, and clinical success in 57 of 62 patients, 91.9%, during a median follow-up of 231 days, interquartile range 90 to 300 days. Percutaneous drainage was needed in 8.1% of patients. Adverse events occurred intraoperatively in 1 of 62 patients, 1.6%, and postoperatively in 7 of 62, 11.3%. There was no procedure-related mortality. Conclusion. This is the largest study on the use of LAMSs for POFCs. It suggests good clinical efficacy and safety of this approach. The use of LAMSs in the management of POFCs is a feasible alternative to percutaneous and surgical drainage.